Welcome, everyone. This is Mayor Steve Haggerty, and you are joining us for a coronavirus Q&A. We are live on Facebook right now, as well as Channel 16, which is the local television station. I appreciate you all tuning in. It's been a while since we have had one of the coronavirus Q&As, but we thought it would be good to have one given the return of our Northwestern students, our juniors and our seniors. And we'll give a little more on that, as well as the startup of our schools. And Halloween coming up as well. So we've received many questions from folks in the community, and I'm pleased today that we are joined by Dr. Robert Dennis Palinkas, who is the Executive Director of Health Services for Northwestern University, who's a special guest today. I don't think we advertised that. And then Luke Fagora, who is the Associate Vice President and Chief Risk and Compliance Officer for Northwestern University. Luke also sits on the Mayor's pandemic task force that we started back in March. And so he's on that every Friday. And I asked both of them if they would join us today because many of the questions that residents asked related to Northwestern. There were some of them. So they're going to join us for the very beginning. And then when we wrap up those Northwestern school-related questions, we will then move to trick-or-treating. And then we'll move to just public health guidelines and enforcement questions that we receive from the audience. If you have a question during this discussion today and you're on Facebook Live, go ahead and put that question in. And our communications team, led by Patrick Degnan, who works behind the scenes, will feed us those questions and we can try and get those asked. Before we jump right into the questions, I just want to give a quick update for folks on where we are here in Evanston with the coronavirus. We continue to do well as a city. I want people to understand that the decisions that we've made and that we will continue to make here in Evanston are going to be fact-based, science-based, based on recommendations from public health experts, and data-driven. That's how we're going to make these decisions, and that's how we have made them. And because of the work of everybody in this community on wearing face masks, on keeping 6 feet apart from other people when you're outdoors or when you're indoors, it's really making a difference. And our numbers relative to many other communities continue to look good. Real quick on those numbers, just the highlights. And this is as of our Wednesday situation report. So each week the city produces a situation report as part of our Emergency Operations Center. I, along with Ike Ogbo, our city manager, our fire chief, our public works chief, are part of the unified command that meets every Wednesday. We produce a situation report. Residents get some of that information every Thursday in the weekly report that comes out from the city, or the weekly newsletter. If you're not getting that, please go onto the city's website, cityofelvanston.org, and sign up for our newsletters. But tens of thousands of people get them, and we are providing information. To date, here in Evanston, we have had over around 1,150 cases of COVID-19 here in Evanston. If you just want a point of comparison, Skokie, our neighbor, is close to 1,500. And they're a little smaller than us. They're about 65,000 people, and we're 75,000 people. And then the city of Chicago is close to 80,000 cases. We have currently ill about 60 people here in Evanston that have COVID-19. Comparing us to other communities on cases per capita. So if we look at cases per 10,000, we're at about 154 cases per 10,000 here in Evanston. Skokie's at 233 and Chicago's at 294. Again, it's just relative comparative data, but it's helpful to be aware of that because I think it gives you a sense that the hard work of Evanstonians is paying off relative to our nearby neighbors, who I would say are also doing well. but have higher per capita numbers than us. Our 7-day moving average is a little less than 6 cases a day that we're recording here in Evanston. A number that you're hearing more and more about is the positivity rate. Our positivity rate in Evanston is at 1.67, and it fluctuates a little, but it's been between 1% and 2% pretty consistently now for quite some time. And the number of cases that had occurred previously in our senior living facilities is way down. We've had a couple recently, but we have done a really good job. Our senior living centers, our senior living pandemic work group led by Mary Leary at Mather Lifeway, who works with all the other senior living centers, they've really done a nice job with their controls. Another data point that's just good for folks to know is the infection rate. You know, how many people are infected by someone that has COVID-19? We have, stayed pretty steady around 1.0, meaning one person with COVID-19 is infecting one other person. Ideally, you want to see that number at 1 or below. When you start to see that number go up, that's when you can have exponential growth of this disease. Lastly, I'll just say, remember, we are part of a larger region here in the community, and so we are part of Region 11, EMS Region 11. That positivity rate for the entire region, which is basically suburban Cook County, is 4.5%. So remember a minute ago I said we're at 1.67%. So we're doing a lot better than the overall region that we're a part of, but we are part of that overall region. Hospital admissions continue to look good. They've increased 3 out of the last 7 days, but there is availability in terms of the medical beds and the ICU beds. We're not having the kind of problem and concern we were worried about. So all this data is good. We opened the beaches this summer. We never shut our lakefront down. We had summer camps this summer. The schools obviously are e-learning, and that continues to be an issue for a lot of families. I regularly talk to the school superintendents. They're part of the mayor's pandemic task force. And we will, they're monitoring all this data really, really well. So some people may say, oh, well, the school said once that infection or the positivity rate drops below 3%, again, they are looking at that wider region, that EMS region 10, which I just mentioned is at 4.5%. And that was as of Wednesday. So that's just a rundown on our data and where we are. The key message is, actions that everyone is taking is making a difference here in Evanston. The level of collaboration between all these different entities, our schools, our hospitals, Northwestern University, the city, is making a difference. Our approach, and I've said this before, and I'll say it until the very end, our approach is a whole community response and recovery. It's no one entity that is going to save you. It is all of us working together. And we're doing a good job, but we need to remain vigilant. It is getting colder outside. We're going to spend more time inside. Public health experts like Dr. Palinkas and others are worried about that. So we'll talk about that today as well. But that's a rundown where we are on the data. Our public health director, Ike Ogbo, has now joined us. So he is with us today as well. And I want to go right into the questions. I'm going to turn to one of you, either Luke or Dr. Palinkas, to talk about how has the return of Northwestern students affected our coronavirus situation, and then I'm going to ask Ike to add anything to that response and give our audience a little background on what Northwestern's done, who actually came back, how many students, and all of that as well.
I think sure. Luke is going to go forward first.
Sure, I could start, and then happy to let Dr. Palinkas and I join in. Appreciate the chance, Mayor, to be here and speak. So just as a quick reminder, Northwestern is back. We've got a relatively few percentage of our classes being purely in person, a slightly greater number being a hybrid approach, and some being virtual. From an undergraduate perspective, we've got our juniors and seniors back. Most of those juniors and seniors live off campus and then roughly about 700 students or so living in the residence halls right now. And so definitely a de-densified approach towards the fall quarter as we reactivate the campus. I would say so far, our experience has gone relatively well. I think we're pleased with where we stand today. Hopefully the community noticed one of the things we put into place was what we referred to as Wildcat Wellness, which is really a modified quarantine to start our academic year as people move back to the Evanston area. And we think that our students took that seriously, and it actually helped with us getting off to the right foot. So you talked about some numbers for the community as a whole and for the region. On a 10-day basis, Northwestern's testing positivity is about 0.35. And we are testing all of our undergraduate students, regardless if they live on campus or off campus, weekly. And we've, I think over the last 10 days, had about 22 or 23 positive cases. Our rolling average is about 1.8 new cases a day that we're identifying. And similarly to what you said, you're talking about the R values, we're not really seeing campus-based transmission. Again, students living together in the community is obviously something that we've paid attention to and worried about, but we haven't seen too much. Our students are doing a really good job, I think, about following the guidelines that we've put out. Again, not to say that it's been perfect, but they're taking it seriously, and that's playing out in many of the numbers. We've done just shy of 20,000 tests physically on campus since people began returning at the end of August. And again, our metrics have been relatively consistent over that time from a positivity perspective and prevalence. So over that period, we've identified, I think, a total of 80 cases, roughly around 80 cases kind of new through our on-campus testing out of that, again, roughly 20,000 tests. So I think to start the year, we're pretty pleased with where we stand. Again, knowing that things can change quickly, we're watching these metrics on a daily basis. But I don't know, Dr. Blinkus, anything you'd like to add?
Sure. Well, I'd like to mention that the health service and Northwestern University in general has a very strong collaborative relationship with the Evanston Public Health Department. Very early on, actually, Ike and I got together to sort of make sure that we had a strong understanding of the need for us to work together, and it's been really, really helpful. And our staff is in contact with the other side, so to speak, every day, and we benefit from that. And also, of course, we remain consistent with guidance that is part of the Evanston Public Health Service and also Illinois Department of Public Health and CDC. So there's just really one voice about how to manage COVID infection. And we do have, thanks to Luke and other members of the senior administration of the university, extra resources have been put into the process that allows us to really take a strong public health posture. For example, we know that testing is important, and Luke talked about that. And that testing is both for asymptomatic students. They go regularly to the Jacobs facility, which we were able to open up and a portion of it expressly for that purpose. And I have occasion to visit it. I was there yesterday. It's working splendidly, and it's a very convenient way for faculty, staff, and students to get their, what we call it, assurance testing. Symptomatic students come to the health service, any respiratory illness. We have basically expanded our capabilities. We have essentially taken over a parking lot so that we can have additional capacity, because we know we're going to be facing the overlap of flu and COVID in the next few weeks, and we're ready for that. Additionally, Luke and I have devised a mechanism for expanded contact tracing. So once a person is detected, number one, they are the actual positive case is isolated. We have dedicated isolation facility on campus. And in addition to that, we interview that individual and we get their close contacts. Many of them are students. If they actually have relatively few, because most of them are doing social distancing. And we work collaboratively with Ike's crew because there are people that are not students that Ike has an interest in. And we share all of our contact tracing information with the Evanston Public Health Department. Once we find a close contact, if it's a person in the Northwestern community, we stay in contact with them because we want to reinforce the quarantine. People who are just contacts, not known positives, are in quarantine. And that's regardless of whether they're on campus or not. We stay in contact with them so that they adhere to the rules of quarantine to protect everybody in the community from getting infected. If a student is in university dedicated housing, they are actually moved to a dedicated quarantine facility. And in addition to just putting them there, we conduct daily case management inquiry with them to see how they're doing. And that is part of our way to assure the health of everybody who's positive and quarantined and get the proper medical care. So I think I'll stop there, but that's our general process in case people wonder, what is Northwestern doing?
Thank you, Dr. Palinkis. I'm going to ask some real rapid questions, quick answers. If a resident in Evanston is interested in seeing the Northwestern breakdown of the data, is that available to them, and where could they find it?
Yes, so Northwestern has a public-facing dashboard on our COVID-19 website. You can click on dashboard and you'll see the total positive results as well as our positivity and weekly tests.
So you can see the weekly number on that, okay? All right, so residents can go there, see the weekly number. Ike Ogbo, our public health director, is with us. And let me just say, Ike is doing a fantastic job for this city and working with all of these different institutions like Northwestern's, like our senior care facilities. And it really has been one of the highlights of my time as mayor is working with Ike Ogbo. Ike, Evanston numbers, can residents find those and where can they find them?
Can you hear me first of all?
We can. Welcome.
Excellent. I'm sorry I had some technical difficulties at the beginning of the presentation. But yes, we have it on our website. City of Evanston, we actually have a dedicated section on our website where individuals can find our results. And on the website, you can also find positivity rates. You can find on a weekly basis what we've been doing here in Evanston. Also some public health messages also included on the website. And I think it's very instrumental in conveying the message to the public where we stand when it comes to the number of confirmed cases and the number of deaths that we've had in Evanston.
Okay. Question we get a lot, and I know you get a lot. Are Northwestern's positive cases included in Evanston's numbers? Can you talk about that, Ike?
Yes, the short answer is yes. Okay. If you are an Evanston resident who attends Northwestern, it is included in our overall tally.
Okay, so if I see today we have 6 cases and there were 2 Northwestern cases, they're included in the 6 if they lived here in Evanston. Okay.
Yes.
Question from Carol, and I've had a similar question from other people since we've had the pandemic, and she was asking, can the city break down out of its number, how many are Northwestern students? And where I've heard that before is I've heard people say, oh, well, can you break down, how many occurred in certain senior facilities in town and all of that? So if you could just talk, because I know there's regulations and everything that restrict, how micro we can get in all the data that we release. But if you could just share that with residents.
Yeah. From a public health standpoint, this is information that we cannot segment. So at this point, we're not considering breaking up information, even if it pertains to Northwestern or any of our long-term care facilities, because there are some privacy reasons attached to that. And not only that, we want to protect our residents as well. So you start to dive into the HIPAA regulations, what information you can release and what information you cannot release. So in this situation, it pertains to what you cannot release under HIPAA regulations. And as I mentioned, we are very understanding that our residents' privacy is paramount, and that's not information that we're going to release at this.
Okay. This is a question that relates to our schools, but I think Dr. Palinkas could also speak about it because there's many residents in our town that not only have school-age children, but they also have college-age children, and many of them are e-learning. And so this is a question that we got from Valerie and Beatrix. How can the city justify allowing restaurants and entertainment activities to be open while not allowing, children or college-age students, I'll add that, to go back to school?
Well,
why don't we start with Ike Ogbo and then?
Yeah, sure, great.
So the city isn't restricting individuals from returning to school. We are following the state guidelines, which at this point, of course, is allowing students to return to school. But these guidelines are put in place to ensure the safety of students returning to school. And this is what we've, of course, conveyed to numerous schools that have started to reopen or have reopened already. Example, of course, our private schools, we've been able to review their plans for a safe reopening, which has incorporated the recommendations and the public health protocols to safely reopen. We've also fielded questions in a safe reopening of these schools because there are numerous questions that are being asked the Health and Human Services Department, and we've been able to provide them guidance and answer those questions. And even when it relates to public messaging as well, we ensure that we send them up-to-date information and sound public health protocols and strategies so that they are informing their constituents well. So these are things that we've actually implemented. It's not that the city is preventing the schools from reopening. We are not doing that. We are following the state guidelines, which ensures the safe reopening of schools.
And I'd like to state that actually Northwestern University likewise follows the state guidelines so that individual schools and colleges, and of course elementary and high schools, need to look at those state guidelines, measure their capability, and if they are ready, submit a plan that is subject to review by public health. And many of them go forward. So Northwestern University has de-densified largely. We do have students on campus, but we have a lot of students who are actually not on campus. And we also, even those that are on campus, generally do most of their learning by remote. So that is the way that Northwestern was able to meet the state guidelines, because the classrooms, when they exist as physical classrooms, are de-densified in a way that meets all the state guidelines. I think that the schools in Evanston are going through that same process. They're doing what they can. I think most schools know that probably in-person education is slightly better than remote, and they would like to go there. The question is, do they have the resources and the physical capability to do so?
Yeah, thank you for that, Doctor. I think the frustration for some here in Evanston is that they look at our collective effort, which I just reported at the beginning, is good, right? Our numbers, our positivity rate, 1.67, 6 cases a day. I mean, all of that is because of the good work everybody's doing. Then why can't our kids go back to the public schools? And I can tell you from my conversations with the superintendents, that the positivity rate that they are looking at closely is that 3% positivity threshold, as well as all the issues that Ike Ogbo and Dr. Palinkas said in terms of how would we actually make this work so it's safe inside. There is a difference between restaurants and classrooms. And And we are maintaining sort of the reduced capacity on restaurants here in Evanston for the time being. And I think you just saw recently this week, I think Chicago's, elevating that and increasing that. We continue to be in close contact with our business community and restaurants about that. But right now, public health in Evanston is holding it where it is. But I think that's the frustration. And so in those conversations with the superintendents, their concern is, again, we have lots of teachers and aides in our schools who don't live in Evanston, who come from all these other communities, primarily in suburban Cook County. And again, suburban Cook County, as I mentioned up front, is 4.5% positivity rate. But nonetheless, it's a real challenge for everybody, for the kids, for the parents, and everyone to do e-learning. What I would certainly encourage our schools and others, and I've said this in the pandemic task force call, let's look and see how effective, the Catholic schools or private schools are, because, they're starting to go back and managing it. And I think that's happening in other public schools as well. So I know it's a priority. I know the superintendents are hearing from lots of people in our community and trying to work on that. One final question, a Northwestern question that came in from Pam, and maybe Luke, you want to take this first. How will Northwestern and the city handle increased visitors related to NU football games to keep people safe? So Big Ten just made the announcement. So maybe you could give our viewers an understanding of exactly what that announcement is and what that actually entails now if we're going to have football games come October 26th in the Big Ten.
Sure. I'll speak to what I know, though these things can change, obviously. But the Big Ten it will try to have a shortened season. There'll be a few home games for Northwestern, but as of right now, the plan is to really still not have public attendance at the games, and the actual attendance would likely be limited to a few number of tickets for the individual players and like their family. And so I think we're expecting very low attendance in the actual facility. We won't be having tailgating activities. That's been restricted for the year. So I think the current thought process, Mayor Haggerty, is that that the playing of football shouldn't drive a lot of additional traffic through Evanston right now. We're across the country. We're seeing that some sports in some cities, some states are experimenting with limited density in the stadiums. But right now, the Big Ten's been pretty strict about this.
Yeah, thank you, Luke. I don't know if we need to say much more on that, other than I'll just remind people. There's always concern whenever we're taking another step forward. Okay, when we open the beaches, when we open summer camps and everything, and like I said at the beginning, we will continue to make decisions based on science and data and facts and public health expertise. And even though we opened and took those steps all along, we didn't see a big jump in our numbers. And so we just all need to continue to be vigilant here. Everybody is doing that here in Evanston. And so we can open up more and more things, take more steps forward. I think that wraps up the questions we had about schools. And so I guess I did have one final question Kelly asked, and I don't know if we really know this answer because the schools haven't gotten this far. What is the testing strategy for schools, specifically for teachers and staff and students, once the district resumes in-person teaching? I don't know if we know that yet.
Yes.
I don't know if maybe you can share.
I can take that one.
Good.
So our long-term care facilities, they have what is required, which is surveillance testing, because of the population that they serve. Our long-term care facilities house our high-risk populations, and it is required that they have routine and surveillance testing. As it pertains to the schools, it is not recommended at this point for surveillance testing. But the schools can definitely have their own testing strategies in place. And what we've also been recommending to schools is for them to consult with their medical providers for testing. But in regards to testing strategies, there hasn't been one that the state has allowed for schools. But as for Northwestern, as you know, they have their testing protocol that they incorporated in their plans that have been well executed. They can do that. So it's left for the schools to establish what their testing protocols would be and ensuring that they're following the public health guidelines in regards to testing.
Thank you, Ike. I think up front you heard either Luke or Dr. Palinkas talk about the number of tests that Northwestern has done. Remind me of that number. Was it over 10 or 20,000 tests that you've completed?
We've done just about 20,000 tests physically on site, nearing 25,000 when you factor in the tests that we did at home before the students actually arrived.
Great. So Northwestern alone has done 25,000 tests. I just wanted to mention to our viewers, because testing has been an issue, right? Not enough testing capacity out there. It's still not ideal. Ideally, we'd like to even have more, but more and more testing is coming online. I can tell you back in April, we had 2,100 people, almost 2,200 people in Evanston tested. Last month, at the end of September, it was 8,800 people in Evanston that were tested. I forget, do those testing numbers include Northwesterns, or Northwesterns are separate from that?
Yeah, they include Northwestern numbers.
Okay, all right. So we do capture Northwestern there, but you're seeing like the number of tests, go up month over month over month. So that is positive news. Dr. Palinkas, Luke, thank you for spending a half an hour with us this morning and with our viewers. Appreciate it. Bye-bye.
Have a nice meeting.
All right. We're going to move on to other questions that you've submitted. Ike, let's go into trick-or-treating. We got a couple questions about trick-or-treating. I've gotten a couple emails. The city sent out an announcement last week to the community about trick-or-treating. Sue and Michelle asked the question, what precautions will Evanston take to minimize the potential spread of COVID-19 during trick-or-treating? Are you going to remind people that everyone needs to be masked and that rubber or plastic masks do not prevent the COVID spread? I can't wear my Joker mask and think that's going to do it. Why did the city decide to move forward? And then somebody's asking, why did the city decide to move forward trick-or-treating, and how can this be done safely? So I think there's concerns out there for people. I mean, I think there's people that are like, I want to do trick-or-treating safely in Evanston, and others who are like, oh, I don't want it at all, or others that say, I don't want people coming to my door. I'm, a high-risk person for COVID.
Absolutely. So we are allowing trick-or-treating at this point. It is proposed, but I also want to remind our residents that we also have the right to modify our guidelines for it to be more restrictive if our numbers start to rise. But I want our residents to be very vigilant and use their best judgment while they attend and participate in festivities like Halloween. So as you indicated, Mayor, we do have guidelines that we've set forth so that we can safely have Halloween and trick-or-treating. And of course, having a costume mask is not going to be a substitute for wearing a face covering. And that's why we want people to be very mindful of the type of costumes that they are purchasing, to ensure that the costumes will allow face coverings that will cover the nose and the mouth. One of the strategies or guidelines that we also refine is to avoid large crowds, to limit the number of houses one goes to, for individuals to stay home if they're sick, and also for individuals to wash their hands before and after trick-or-treating, just to keep everyone safe. And let's not forget about social distancing while we are celebrating Halloween. That's very important.
Yeah.
And I think the reason why, of course, we're having Halloween at this point is because our numbers are actually looking pretty good. I would consider Evanston a high incident environment or community. Our positivity rate is less than 2%. And as you know, the threshold, according to the state, is 8%. So we are way below that 8% threshold that will make us become more restrictive. And that's why at this point we are allowing. And as I mentioned, we reserve the right to pull things back if our numbers start to rise.
Right. And I think the news that we all woke up to this morning, hearing that the President of the United States and the First Lady tested positive for COVID, is just a great reminder to all of us that, masks make a difference, right? Wear your mask when you're out there. Keep 6 feet apart. And these are measures that public health experts know can, minimize the spread of this disease. And we know that that wasn't being done, in the White House. It's widely been reported. But when this is done, it can make a big difference. And I know there's a lot of people here in Evanston doing this. I want to put a plug in right now for a wonderful challenge that's going on in our community. It's called Behind the Mask. If you Google Behind the Mask, and it's also on our city website, and we're going to put it in our Thursday, actually it went out in our Thursday newsletter yesterday. You could see it at the bottom. And a bunch of young people in our community, advocates for action, put together this campaign, and they're asking for anyone to do a quick video, a TikTok, you name it, be creative, and then there's going to be prizes. It's going to run the entire month of October. And again, it's behind the mask. Let's now move to the one other thing on Halloween that I just want to mention, because a lot of people have said, hey, I want to know, like, I'm concerned, if I have a bowl of candy, I want to accept trick-or-treaters, I'm not going to have them in the house, period. I'm not going to be in my house. I'm going to be outside. Maybe I'm going to set up a table or something like that. I'm concerned, like, with the bowl, so you're going to have to, if you accept trick-or-treaters, sort of set, hey, here's, to the extent you can, here's the procedures here at my house. We're going to enforce those as a city, and we already have. But there's some really creative ideas on how you can make, candy available. I mean, I've seen people put boards up and they literally put a staple in of all these M&Ms, and so a kid comes up and just takes one and throws it into their bag. So there's lots of things that you can do. And if you Google that, it'll give you a lot of ideas out there. Let's go on to public health guidelines and enforcement. Ike, we got a lot of questions here. So I know we have to stop at 1. I have a hard stop. So let's try and see if we can get through these quickly.
Okay.
Margaret asked, how are precautions and mandates around COVID-19 being enforced, specifically outdoors? You get a lot of emails. I get a lot of emails. People saying, hey, Mayor, I saw somebody, they weren't wearing a mask. They need to be wearing a mask. Remind people what the outdoor mask policy is and what people should do.
Absolutely. So our outdoor policy is to wear a mask when you can't maintain a 6 feet social distance between others. And that also applies indoors. And in terms of enforcement, we do have public health codes that allow us to do enforcement during this pandemic. And we've achieved compliance through letters, reminders, notices, orders, instructions, and inspections. And it's something that we started, of course, at the beginning of the pandemic and will continue throughout the pandemic. And not only that, what we've also implemented is when we are having social events, outdoor events, special events, that we have a significant input in allowing or disallowing these outdoor events to ensure that they meet public health strategies and protocols. And in some situations, of course, we ask organizers of these outdoor events to revise their plans to suit what the guidelines are for phase 4.
Great. Madeline asks, will the city mandate wearing masks on streets, sidewalks, and everywhere outside? There's some people that would like a hard and fast, when you're outside, you have to wear the mask. Even if there's nobody around, you gotta wear it. I know that's not the policy of the state, and and Madeline's saying, hey, why doesn't the city impose that?
In this situation, we are following the state guidelines by individuals wearing a mask when it isn't practical to stay 6 feet away from individuals. And keep in mind, what causes the transmission is respiratory droplets when you sneeze, when you cough. And if you don't have anyone within the vicinity of 6 feet, that really isn't particularly a reason to wear a mask. So that's why we continue to emphasize wearing a mask when you are within close proximity of individuals. And if it's impractical, to maintain that 6 feet distance between individuals.
Yeah. What really upsets me is when I go to restaurants and I'll try to talk to the manager or the owner of the restaurant when I stop in there. And it's usually for me, it's usually I go in for takeout during lunchtime and I'll say, hey, how's it going? And how's the business doing? And one of the frustrations that I've heard from some of them is that people have come in not wearing masks. And that sort of shocks me because in general, I think people understand like indoors, you've got to wear a mask. And so again, as it gets colder, all of us need to be wearing a mask. I can't stress that enough. And again, when you are outside and there are other people in close, proximity and vicinity to you, you should be wearing a mask. It is a good measure. We know it makes a difference, and it keeps our community safe. Kelly had mentioned this, and I'm going to move on to a different topic, but it was about masks and just saying that at the new Robert Crown Community Center, lots of people are excited about the new center. They're outside, they're playing on the fields, and I'm not seeing hardly enough people wearing masks. So, I will, or Ike, I'll just ask that you make sure to get with Lawrence Hemingway, our Parks and Rec director, and make sure we've got proper signage and everything else at that new facility so people understand. Because obviously we've got the lights. There's a lot of people there. Everybody's excited about it. And another plug, we are going to have a celebration, masked only. Okay, so you got to come with your mask on tomorrow at Robert Crown Community Center at 10 a.m. to celebrate the work of so many people, thousands of people in this community to make that project a possibility. Let's see. Christina asks, as we enter fall and winter, should we be doing anything in addition to washing hands, keeping a 6 feet distance, and wearing a mask?
Absolutely. So we should continue to employ these practices: washing hands, social distance, wearing your mask. And also, one thing that I will encourage people to do is flu vaccinations during this period is very important, so that will keep us healthy throughout this pandemic. And one of the things that people can employ is to ensure, especially with our elderly population, Mayor, is to ensure people who are coming into their vicinity or coming into their units wear masks. If you have caretakers, to ensure that they wash their hands before attending to you. And also making sure that individuals who have underlying health conditions or taking their medications. So these are all things that we can put in place or continue to put in place to ensure that we all are healthy through fall and winter, and as this pandemic actually persists.
I think another thing that can be put in place, and I'm happy that my building did, that I work in downtown, which is the Hahn building. I mean, there are signs on both the doors now that say mask required. It's sort of a cool sign and everything. And some people may say, well, I don't have to wear a mask. I'm not, 6 feet, I don't see anybody else around here. But you walk up the stairwell and all of a sudden you're right next to somebody else that's in the building, and we have so many offices and so many, multifamily, buildings here in town where many people live, that those buildings themselves and all the common areas, require masks.
Yeah, absolutely. And it was included in one of our newsletters. In situations where the areas are confined, where people can't meet the 6 feet distance, like elevators, stairways, laundry rooms, common laundry rooms, that people wear masks in those areas.
Yeah, I park in the parking garage downtown, and I always put my mask on when I get out of the car because I got to get in the elevator. And I've yet to run into somebody that doesn't have a mask. I mean, everybody seems to be doing that, but we just need to keep doing it. We know, again, from public health experts, we know historically from the 1918 pandemic that there was a pickup. Okay, come the fall. In October, the numbers really rose back in 1918. In December, they rose as well. So I can't stress the importance, again, of masks enough. Kathleen and Karen asked, And again, I don't even know if our numbers are big enough to answer this question, Kathleen and Karen, but they asked, what activities are accounting for the spread of COVID-19 in Evanston? Are there any patterns? So before you answer that question, I want everybody to know we have been doing contact tracing since day one. We continue to do contact tracing. We've just hired half a dozen new contact tracers that are working for the city. Part of the purpose of contact tracing is to try and figure out, where is this emanating from? It's not as easy it's not super easy that you can always tell. But that was the question. Can you tell where the spread's coming from in Evanston?
Well, our experience so far has been with household members. And as we are in these phases, especially right now that we're in phase 4, although we have some reopening, but people are still working remotely. And because of the close proximity of household members, we've experienced some spread within household members. And for those who also go outside, as we all know, COVID is widespread. And we are a mobile community where we travel, where we engage in various activities. And we've actually seen some spread as well in those situations. And not only that, some spread into traveling outside Evanston or traveling to another state or so has also been a fraction of where we have seen our transmission rate. But for the most part, it has been within household members that we've experienced.
Okay. How long Karen had asked this question, since we touched on contact tracing just now, I'm going to ask it. Yes, Karen, we are still conducting contact tracing. We have since case 1. How long does it take the city to reach close contacts of an infected individual?
Okay. Our policy is to reach individuals within 24 hours of receiving a case. And it is something that we've implemented and conducted plus done since we received our 2 confirmed cases, as you remember, Mayor, back in mid-March. So it requires us those 24 hours to get in touch. To ensure that we give instructions for individuals to quarantine. So it's been working well for us. And people have been compliant as well. I think people had maybe a number of issues with people refusing to quarantine, but of course after we've told them what the implications are, they were compliant. So kudos to our community members for complying with our public health orders. It's very essential in these times.
Is there an average number of contacts per cases?
It varies. It varies. If we have household members, it can be just the members of that household, 3 to 4 individuals. If you have an individual who is more interactive with the public, that number might rise. Especially if you're going to work, then you've had these interactions that meet the public health protocols for contact tracing, then those numbers in that situation rise. So it varies depending on time spent with individuals, where the person is the person working remotely at home and having less interaction with the public. And it depends on the type of work an individual does or activities that individual engages in.
Okay, all right. Patricia asked, will Evanston be loosening its restrictions around indoor dining and capacity at theaters and performing art venues?
Not at this point. We're following the state guidelines, and we are not going to be relaxing our guidelines as it pertains to restaurants currently.
Okay. I know it's a particularly hard time for all of us that love the arts and performing theater. I worry about it a lot. I talk to some of the directors of these different programs, whether it's the Music Institute, Northlight Theater, which is interested in coming to Evanston. I'm very worried about Century Theater. There was a big article, I think, in the Wall Street Journal, one of the newspapers this week, about them asking Congress for some kind of aid because it's concerned about theaters across this country. And they are a big part of the life and the energy of a city, right, is your theaters and everything. So it's on the minds of a lot of people. Patricia, I know. The challenge with theaters, again, is they do need to have a certain number of people in there to actually be able to financially operate. And we're limiting the number, and it's indoors and everything. So that's that. I will stress, stay calm and carry out. It has been our tag, and I think a really successful one. And talking to the restaurateurs, a lot of them are just, breaking by because so many people are willing to do a takeout or carry out. So please, as the fall season, the winter season come, please continue to do that to help support them. Again, we don't want to lose the essence of Evanston. Before we don't want to lose the essence of Evanston, and we risk losing that if we don't keep supporting our local businesses as much as we all can. All right, let's move on for the final questions on testing and vaccines, something that would excite all of us. When a vaccine is discovered, well, first off, before I ask Christine's question, give us an update on what you're hearing as a public health official on where we stand with a successful vaccine being brought to market.
Absolutely. So we've been having meetings with the state in regards to vaccine acquisition, distribution, and administration. We're keeping tabs. We have these regular meetings. As it stands, we are hopeful that there will be some vaccines at the tail end of the year. Actually, we're at the tail end of the year. They're proposing sometime in November or December, but it will be a very limited supply. So the way that we are looking at this is who gets the vaccine first. And the way that it's structured is looking at our most vulnerable residents, those in long-term care facilities, and those who take care of the public, being our healthcare workers, and of course our first responders. And of course, equity will be applied across the board when it comes to the dissemination, the administration, and the distribution of the vaccine. So these are things that are still being worked out. The plans are not concrete at this point. We are revising, adding, removing as information gets to us. So it is still in the works, and we're hoping that we will have a final answer to when are we actually going to get these vaccines in these upcoming weeks. But everyone should stay tuned.
So Christina asked, when a vaccine is discovered, what are the steps taken to ensure that it's safe for the public? And is there a time frame you could give for distribution and things going back to normal once a vaccine is created?
Right. Once CDC releases the vaccines, they will release products of those vaccines that are safe for the public because it's undergone various testing stages. It is very hard to say how long it will take to vaccinate the population in Evanston. It will all depend on the availability of the vaccines and the allotment that Evanston gets. And these are still being sorted out by the state. And like I mentioned, information will get to us when it does, but the states, they are still working through these angles. But it'll be hard at this point to pinpoint how long it will take for us to vaccinate our population.
I want to stress for Christina and the viewers, when I was on a call several months ago with Dr. Fauci and a whole bunch of mayors around the country, he stressed, and I can't emphasize this enough, he stressed that they are not, as long as he's in charge up there, they are not going to release an unsafe vaccine to the public. He said the risk that the federal government is taking is a risk of money. We are trying to accelerate so quickly the development of a vaccine. If we're lucky and we get a couple breaks, possibly, and this was several months ago, he said we could have a vaccine by January or February 2021. If we don't get the breaks, it takes longer. Maybe then we're looking at September, October 2021 till we have a vaccine. But under no circumstance will we be releasing a vaccine that is unsafe. It felt very reassuring to hear Dr. Fauci say that, and he stressed that quite a bit. So last question from KR. Does the city have a plan for vaccine distribution once it becomes available?
Yes, it is a plan that we've been working on for months, actually. And the situation is very evolving. And We update our information as information reaches us from the state. We either remove, add, and revise these plans, but there's definitely a plan for it. And as I mentioned, from what we're hearing from the state, there's going to be quite a limited supply at first. Then going into 2021, there will be ample supply of the vaccine. And the way that I mentioned we're looking to structure it is for those individuals who are the most vulnerable amongst us getting it. Then, of course, the healthcare workers, because, of course, they have to be healthy in order to take care of the population. And, of course, our first responders before it goes to the general public. But all of these might change depending on the availability as we approach in these months. But if it's an unlimited supply, that is how it's going to be approached.
What about our mayors, Ike? You didn't say anything about our mayors. They're at the end. I think all our politicians are at the end of the line. I think they're all at the end of the line.
We'll also take a look at critical workers and essential workers. So they should be also in that priority.
I thank you for being with us. I know everyone in Evanston appreciates what you are doing for our city and your leadership. Thank you to Dr. Palinkas. Thank you to Luke Fagora at Northwestern for joining us today. Thank you to everyone for taking some time and catching up on this coronavirus Q&A. Be well, and remember, wear your mask. Bye, everyone.